one of many questions being asked about protecting ourselves as states begin to open back up, of course. A new study just published offers up some startling perspective on that, showing that ordinary speaking can release respiratory droplets into the air that can linger for more than 8 minutes. It was an experiment using laser light, and researchers also found that someone talking loudly can emit more than 1,000 droplets in a very short period of time. So what does this mean for the spread of the coronavirus? Joining me right now, Dr. Mark Rupp. He's chief of the Infectious Diseases Division at the University of Nebraska Medical Center. It's great to see you again, Dr. Rupp. Thank you for being here. This study was published in a peer-reviewed journal. What does this tell you about the potential spread of this virus? What should it, I guess, tell people without a medical degree?
Well, I think there's a couple of implications of this study. First of all, it may give a pretty good explanation of why we see transmission of the disease in people who are asymptomatic. Prior to developing symptoms, they may have replication of the virus in their upper respiratory tract. And in interacting with people just through simple conversation, they can generate these droplets that, if they're shedding virus, could contain the virus. And even though they're not showing symptoms, could potentially explain why it's passed from one person to another. I think it also really emphasizes the importance of why we should all be wearing masks when we're out in public. That's because, again, there are certain instances where people can be in the pre-symptomatic phase before they develop symptoms. If they're wearing a mask, this will really help to decrease the generation of those droplets and then how far they would be projected from somebody. But it's really no surprise that when somebody's talking, they're going to be generating these droplets, and then that increases even more if they're trying to really extend their voice and fill an auditorium, or in a real extreme example would be at a singing or choir practice. There was a big outbreak in Washington State a few months ago where in a choir practice where there was probably somebody who was asymptomatic was singing at the choir practice and ended up resulting in a lot of people becoming infected and even some deaths in that instance.
Yeah, there's a lot we don't know about this virus, but this seems to be one thing that is consistent throughout, how asymptomatic, how it can be spread, especially in this fashion that we're talking about here. There are also reports, Dr. Rupp, I wanted to get your take on this, of the more reports we're hearing about this really troubling inflammatory response in children that's being linked to the coronavirus. The CDC is now putting out an alert to physicians about it, but it is fortunately still rare. What is your level of concern about, they've now put a name to it, multi-system inflammatory syndrome in kids?
Yeah, so I think that as we gain additional experience with the coronavirus during this pandemic, we're going to continue to see and explain rare clusters and compilations of symptoms. I think that's what we're seeing here with these kids. I think there's a couple of messages here. Number one is one of reassurance that this is pretty doggone rare, and that for the most part, kids don't have severe disease, and there are very limited numbers of cases of having this inflammatory response to the virus. Now, some people are saying this looks a lot like what's known as Kawasaki's disease or Kawasaki syndrome. This is something that we've known about for decades. The other name that it goes by is called mucocutaneous lymph node syndrome. So these kids have inflammation of their conjunctival membranes, their mouth, they have a rash, they have swollen lymph nodes, and in the worst instances, they can get inflammation of the heart and the coronary arteries, and that can be devastating. Similar to what we're seeing with this multi-inflammatory poly-organ system involvement that is being described now, where multiple organs can become inflamed and angry and dysfunctional. For the most part, these kids have recovered, which again is a reassuring message. There have unfortunately been a few children who have died of this syndrome.
Yeah, it is amazing from where we were in the beginning of what we thought was just a very scary respiratory disease virus is now infecting so many more organs and so many different classes of people in so many different ways. It is remarkable, the evolution from the first time that you and I had an opportunity to speak. Dr. Rupp, thanks for coming in.
Absolutely, my pleasure.
Thank you.